So guys, in this section we will talk about the blood vessels of the upper limb, and the way we'll approach is that we'll start with the blood vessels in the axillary region. So that we'll talk about the axillary artery. Then we will talk about the anastomosis around the scapula, which is between the axillary artery and the subclavian. We'll proceed to the brachial artery. We'll talk about the major branches of brachial artery. We will also see how brachial artery, along with its branches like radial ulnar artery, forms an anastomosis at the elbow anastomosis. We will also see the distal course of radial ulnar artery in the hand and how they help in the formation of superficial and deep palmar arches. I'll keep showing you some images also in between. So let us first start with the axillary artery. Now, axillary artery is divided into three parts by a muscle which is crossing in front of it, and the muscle is pectoralis minor muscle. So let's imagine this here is a coracoid process. Coracoid process is the process on which the pectoralis minor muscle will insert, and here we have this muscle that is pectoralis minor muscle. Just highlight that for you. This is pectoralis minor. And passing deep to this pectoralis minor, we got the axillary artery, which is divided in three parts because of this muscle only. So here we have, this is the axillary artery, let's say. As we know that axillary artery starts from the outer border of the first rib, that is where the subclavian artery ends and the axillary artery begins. Now this here is the first part of axillary artery, which is proximal to the pectoralis minor. Here we got the second part of axillary artery, which is deep to the muscle, and the third part of axillary artery is distal to the muscle. So we got 1, 2 and 3 part, and the branches of axillary artery can also be easily remembered with the same 1, 2, 3 sequence only, because first part of axillary artery will give 1 branch, second part will give 2 branches, and third part will give 3 branches. So guys, only branch coming from the first part of axillary artery, this is called as the superior thoracic artery. There is a superior thoracic artery, and that is the only branch coming from the first part of the axillary. 2 branches from the second part, that means both these arteries are starting deep to the muscle itself. So one of the artery here which runs deep to this muscle and then emerges at the lower border of pectoralis minor, the artery is called as the lateral thoracic artery. This is the lateral thoracic artery. It is also one of the major arteries supplying the mammary gland. Although mammary gland is mainly supplied by the internal thoracic artery, also called as internal mammary artery, coming from the subclavian. But yes, we can say lateral thoracic artery is also having a good contribution to the mammary gland here. So as you can see, the artery is going deep to the muscle first and then running along the lower border of pectoralis minor. We also have another artery which is originating behind this muscle itself and then emerging from the upper border and subsequently dividing into 4 more branches. This artery here is called as the thoracoacromial trunk. That's the second artery we're talking about from second part, guys. There is thoracoacromial trunk. It's a trunk. This thoracoacromial trunk or thoracoacromial artery is further going to divide into 4 branches. And those 4 branches can be remembered as A, P, C and D. Not A, B, C, D. A, P, C, D is the right way to remember it. So 4 branches of thoracoacromial trunk. Let me write it for you. A stands for the acromial branch. A is for the acromial branch. So you will see a branch of this artery going toward the acromial process. P stands for the pectoral branch. Pectoral branch also supplies the mammary gland and the pectoral muscle, that is pectoral branch. C is for the clavicular branch. C is the clavicular branch, and D is the deltoid branch of thoracoacromial trunk. So when this trunk comes out, it pierces the fascia here called as the clavipectoral fascia and divides into the 4 branches, that is acromial branch, then we have a pectoral branch, we got a clavicular branch, and we got a deltoid branch. So they are all running in different direction and supplying the respective structures. So one artery from the first part, and we saw 2 arteries from the second part. One is lateral thoracic and one is thoracoacromial trunk. Now coming to the third part of axillary artery, this third part is very close to the surgical neck of the humerus, and that's why the branches are also in accordance. So guys, let us say if this here is the shaft of the humerus, just presume it is the shaft of the humerus here, the surgical neck and the shaft of the humerus. So what you will see, from the third part we have 3 branches. Number 1, we have a branch which is the largest branch of axillary artery. I'll tell you about its name. And then we have 2 more branches slightly more distal to it. One winds anteriorly to the surgical neck of humerus and another one winds posteriorly to the surgical neck of the humerus. What arteries are these? Well, this artery which is winding posteriorly here, this here is called as posterior circumflex humeral artery. I'm writing in short PCHA, posterior circumflex humeral artery. Whereas the one which is winding in front of the surgical neck of humerus is the anterior circumflex humeral artery. So PCH and ACH are the 2 branches here. And then we said the largest branch of axillary artery is also coming from the third part, and this is the one I was talking about. This is the subscapular artery. This artery here is a subscapular artery here. Let me just quickly recap it for you. So what we said, that from the first part we have only one branch, and that only branch was superior thoracic artery. Done. Second part, we said we got 2 branches here. One is thoracoacromial trunk, which you can see further dividing into 4 branches, and also the lateral thoracic artery. You can see they are coming out of the upper border and the lower border of pectoralis minor muscle respectively. Third part, 3 branches. Third part, 3 branches. Subscapular artery being the largest branch. I'll tell you more about it. And then we have the 2 arteries which are winding around the surgical neck of humerus, that is ACHA and PCHA, anterior circumflex humeral artery and posterior circumflex humeral artery. So 1 branch from first part, 2 branches from second part and 3 branches from third part of axillary artery. Whenever we talk about the blood vessels in the, whether it is in upper limb or lower limb, one important thing that you must remember is if there is any nerve which is closely related to them, that makes it a very important surgical relation. Like there are 2 important nerves that we need to discuss here. A nerve that you see running behind the surgical neck of humerus along with posterior circumflex humeral artery will be axillary nerve. So guys, along with this PCHA, we got an axillary nerve running in like this. I'm writing in short, this is axillary nerve. That's a one very, very important relation. That axial nerves runs along with the PCH, along with the posterior circumflex humeral artery. Second important relation is subscapular artery. Guys, along with subscapular artery, you will see a relation of the nerve, and this nerve here is the thoracodorsal nerve. This is the thoracodorsal nerve. Also, you can say nerve to latissimus dorsi. So, thoracodorsal nerve also can be called as nerve to latissimus dorsi. So, second important relation is along with subscapular artery, we have a thoracodorsal nerve or nerve to latissimus dorsi. It again is an important surgical relation here. In the flap transferring of the latissimus dorsi, when you take a flap of latissimus dorsi, you take it along with the artery and the nerve. And you can see both of them running together here. Subscapular artery, apart from supplying the subscapularis muscle, it does supply latissimus dorsi. And thoracodorsal nerve, of course, it supplies latissimus dorsi. Another important relation, we said axillary nerve along with PCHA. You know, if there is for any reason, if there is a injury to the axillary nerve, like if there is a inferior dislocation of the shoulder joint, or if there is an injury at the humerus at level of surgical neck of humerus on the posterior aspect, then not only axillary nerve, even the posterior circumflex humeral artery can be compromised. So first thing first, guys, these are the branches from the axillary artery. Remember one thing, I mean, let's not spoil our diagram for this. Axillary vein will be seen running along with the axillary artery throughout its course on its medial side. So whether it is first part, second part or third part, axillary vein is present on its medial side. I would recommend you not to draw it. I'm just doing it for your orientation sake like this. Axillary vein will be running in this manner. Just keep it in mind that one constant medial relation of the axillary artery will be the axillary vein. And people do have a little difficulty in remembering the relations of the axillary artery. And I would say that the easiest way to remember the relation of axillary artery is, think about the brachial plexus. When you think about the cords of the brachial plexus, the cords are obviously the more distal part of the brachial plexus, right? And those cords are related to the third part of axillary artery. The nomenclature of the cord in the brachial plexus is based on the relation to axillary artery only. Like lateral cord of brachial plexus is lateral to this part, medial cord is medial to this part, and posterior cord is posterior to this third part of axillary artery. So guys, if you're thinking about the relation of the axillary artery, third part relations are very, very simple. Think about the branches coming from the lateral cord of brachial plexus. They will forming the lateral relation, like musculocutaneous nerve is there, right? Then think about the posterior cord of brachial plexus. Posterior cord is having the branches like what? Like radial nerve. It is also having the branches like axillary nerve. They are obviously the posterior relation. Medial cord of brachial plexus, nerve like ulnar nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, they are all coming from medial cord, medial relation of the axillary artery. So don't try to mug up all these relations. It's pretty simple, and especially the third part relations, you just have to think about the cords of the brachial plexus and the branches coming out from the cords of brachial plexus, and you can easily compare it. Now, knowing these branches, first let me show you these branches on a picture, on an atlas image, and then we will talk about the anastomosis around the scapula. So here we have an atlas image in which we will discuss the same thing that we just saw. So as you can see, the muscle over there is a pectoralis minor. Let me just keep marking all these things. This is a pectoralis minor muscle. And you can see pectoralis minor muscle is getting inserted to this coracoid process. So this is the first part of the axillary artery. Deep to the muscle here, that is the second part here, and distal to the muscle here, we got the third part of axillary. You can see from the first part, very much in the beginning, only the artery coming out here is a superior thoracic artery. I'm just writing everything in short here. That is a superior thoracic artery. From the second part, as you can see, a artery coming along the lower border of pectoralis minor. This is lateral thoracic artery, and the one that you see which is emerging at the upper border, and you can see dividing into 4 branches also, that is a thoracoacromial trunk. That's a thoracoacromial trunk. Third part, look at the third part giving off this ACHA, that is an anterior circumflex humeral artery, and the one which is behind that is a posterior circumflex humeral artery. And yes, this one here is the largest branch of axillary artery. We said that is a subscapular artery. So these are the branches coming from the 3 part of axillary artery. Superior thoracic artery, we got a thoracoacromial trunk and lateral thoracic artery from second part, and third part you can see the 3 branches coming out from there. Okay, now why this topic is so important, the axillary artery and its branches? Because axillary artery is crossing a one very, very major joint, that is a shoulder joint. So in case of dislocation of shoulder, there are very good chances that this head of humerus, it can compress the second part of axillary artery. If there is a shoulder dislocation, there are chances that the head of the humerus will come forward and it can compress the second part of axillary artery. So if the second part of axillary artery is compressed, then how the blood supply to the upper limb will be maintained? And that is where the anastomosis around the scapula comes into the picture. Guys, anastomosis around the scapula is an anastomosis between the first part of subclavian artery. I'll tell you that first part of subclavian artery will be somewhere here, and the third part of axillary artery, so that even if there is any obstruction anywhere here on the second part, or even in the first part, or even in the distal part of the subclavian artery, still the blood supply to the upper limb can be maintained. Let's talk about the topic, and then I will show you the picture for the scapular anastomosis. So we're talking about the anastomosis around scapula. Now practically this scapular anastomosis, as I said, it is an anastomosis which is present between the first part of subclavian, it is present between the first part of subclavian artery and third part of axillary artery. Third part of axillary artery. I'm not saying that there is no other contribution from any other part of axillary artery, but yeah, it's mainly anastomosis between the first part of subclavian and third part of axillary artery. Now, before I draw this, I want you to narrow it down. We already discussed the subclavian artery in the head and neck region, guys. Subclavian artery, third part, first, second, third part. You know that subclavian artery is divided by the muscle, that is a scalenus anterior muscle. Third part of the subclavian artery is having a branch. First part of subclavian artery, I'm sorry, is having a branch. One is called as a vertebral artery. Now, vertebral artery is the one which goes above, goes into cranial cavity. So forget about it. Another branch from the first part is the artery which is called as the thyrocervical trunk. Now, thyrocervical trunk is the one which supplies a it supplies a thyroid gland. It gives a like inferior thyroid artery. It gives off the suprascapular artery, and it gives off the transverse cervical artery and suprascapular artery. So if you look at these names like transverse cervical artery, it must be running somewhere transversely in the neck region, and the suprascapular artery, suprascapular. So obviously it is the one which is coming to the scapula here. So that thyrocervical trunk from the first part of subclavian artery is needed here, and we just saw the branches coming from the third part of axillary. Let me put it together. Let's try to draw it and then we'll discuss more detail of it. So let's presume this here is a scapula. Right? So we got an axillary artery, we got a first part of axillary artery, first part of subclavian artery, which is somewhere here. And continuing with that, if I reach in here, this is the third part of the axillary artery. I'm removing the middle part just to avoid any confusion. So we have the first part of subclavian, and then ultimately you are looking at a third part of axillary artery below. The branch that we said we need from the first part of subclavian artery, here is a thyrocervical trunk. Now look at this, guys. Let's say this trunk here, this big trunk coming from here is a thyrocervical trunk. Thyrocervical trunk. And just to clarify again, the thyrocervical trunk is coming from where? It is coming from the first part of subclavian artery. It is from the first part of subclavian artery. What are the branches from thyrocervical trunk? Now, one of the branch from thyrocervical trunk is inferior thyroid artery. Well, that has gone above and supplying the thyroid gland, not of concern here. The remaining two branches from thyrocervical trunk are the one which are needed here. Like one is called as suprascapular artery. Of course, the name says suprascapular artery is the one which will come like this from the suprascapular notch and will participate in the scapular anastomosis. And this suprascapular artery also gives off a branch toward the acromion process as well. We call it acromion branch. Let me mark that for you. This here is the suprascapular. That is the suprascapular artery. And as you can see the acromion branch of suprascapular artery is also there. Another branch here is the transverse cervical artery. Transverse. It's running transversely in the neck. So guys, we call it a transverse cervical artery. And the transverse cervical artery, it further divides. We already discussed that in HNF. Transverse cervical artery, it divides into a superficial branch and the deep branch. The deep branch of transverse cervical artery, which is also called as dorsal scapular artery, will run along the medial border of scapula. Look at that. And reaches all the way to the inferior angle. Yes, this is giving off numerous branches on the surface of scapula also. So what artery is that? This is the deep branch of transverse cervical artery. Either you simply call it deep branch of transverse cervical, or this is called as the dorsal scapular artery. Sometimes dorsal scapular artery comes from third part of subclavian also. That is a variation. But dorsal scapular artery usually is a name given to the deep branch of transverse cervical. So guys, this is the contribution which is coming from where? From the first part of subclavian. Let me repeat that again. We said what? Suprascapular artery, number one. And second is a deep branch of transverse cervical, also called as dorsal scapular artery. Okay. Now it's time to look at the third part of axillary artery. Now you already know the branches from the third part of axillary artery includes, there is an anterior circumflex humeral artery and there is a posterior circumflex humeral artery. Let me go with that first. This is ACHA and this is PCHA, posterior circumflex humeral artery. Now out of these two, the one which is participating in the anastomosis around the scapula is PCHA, not ACHA. Remember, it's PCHA. Posterior circumflex humeral artery will also give off a branch which will go above toward the acromion process and participate in the anastomosis here. This again is called as an acromion branch. That is an acromion branch of suprascapular, and this is an acromion branch of posterior circumflex humeral artery. And we already discussed one acromion branch just now in the previous discussion. We saw there is a branch from the second part of axillary artery. What was the second part of axillary artery? That was a thoracoacromial trunk. Thoracoacromial trunk was giving 4 branches, A, P, C, D. A was what? Acromion branch. So we have one more acromion branch. Let me put that here as well. That acromion branch is coming from, this is the acromion branch of thoracoacromial trunk. Thoracoacromial trunk. So there are 3 acromial branches you are looking at, and this anastomosis here, which is taking place at the acromion process, is called as an acromial anastomosis. This anastomosis, guys, is called as the acromial anastomosis. That is an acromial anastomosis. So when we talk about the scapular anastomosis, there is one anastomosis which will be taking at the body. But before that, I'm looking at an anastomosis taking place at the acromion process by the 3 acromial branches. From where? One from suprascapular, one acromial branch is from posterior circumflex humeral artery, and one acromial branch is coming from the second part of the axillary artery, that is from the thoracoacromial trunk. That's an acromial anastomosis. Now coming back to the body part. Now what branches are participating in the anastomosis at the body here? Largest branch of axillary artery we said is subscapular artery. Now look at this. If let's say this is a subscapular artery, it will be running along the lateral border and going down, anastomosing at the inferior angle. What artery is that? This is the subscapular artery. This artery here is a subscapular artery, and that's how there is an anastomosis which is formed at the inferior angle. Now even this question can be asked, that what arteries are anastomosing at the inferior angle? You can see that one is a dorsal scapular, or you can say deep branch of transverse cervical, and from this side we have a suprascapular artery. They are anastomosing at the inferior angle. At the body, well, this subscapular artery gives off a branch which winds around the lateral border of the scapula and then gives off numerous branches to anastomose with other branches on the body here. This artery, guys, is called as circumflex scapular artery. I'm just putting an asterisk sign over there. I'm writing it here. This artery is called as what? Circumflex scapular. Circumflex scapular artery, which is a branch of subscapular only. So that's another anastomosis which is taking place in that region here. That is on the body. So overall, I can say in detail that the anastomosis around the scapula can be divided in 3 parts. Anastomosis at the acromion process, anastomosis at the inferior angle of the scapula, and anastomosis at the body. You can see the body anastomosis is by what? Suprascapular, is by the deep branch of transverse cervical, and also by the circumflex scapular artery. This is how we have a rich anastomosis around the scapular region. So in case of there is a shoulder dislocation, if there is a compression of the second part of axillary artery, thankfully we have this anastomosis which can still maintain the circulation for the upper limb. Now time to see the same anastomosis in one of the atlas image. It's always good to keep looking into this atlas image so that later on you can, when you see the cadaveric picture, you can easily correlate them here. Let me take you to that. So we already saw these branches of the axillary artery, guys. Now I'm taking you to this picture showing the anastomosis around the scapula. The difference is the diagram that we drew was considering the costal surface of the scapula, the anterior surface. Now we are looking at the dorsal surface of the scapula. Doesn't matter, we can still easily identify it here. Now look at this, guys. What branches I can appreciate in there? I can see from the first part of subclavian artery, this here is a thoracoacromial trunk. I'm writing TAT, that is thoracoacromial trunk. And from this thoracoacromial trunk, I can see this branch coming in here. This is the suprascapular artery. That here is a suprascapular artery, and I'm sure you can also see this acromion branch of suprascapular artery as well. I'm just writing AC, acromion branch of suprascapular artery, also going toward the acromion process. Suprascapular artery is coming down like this toward the body, but our acromion branch is going toward the acromion process. Whereas this one here is the deep branch of transverse cervical artery. That is a deep branch of transverse cervical running along the medial border of the scapula all the way till inferior angle. Looking on the other side, because the view is from posterior side, that's a posterior view. So this here is PCHA, posterior circumflex humeral artery, and you can see this branch coming from posterior circumflex humeral artery. Again, that's an acromion branch. That is an acromion branch. The two acromion branches are shown here in this. Look at the branch which you can see. I hope you can follow this pointer here. Look at this artery which is going down here. That is a subscapular artery which will be running continually like this along the lateral border of the scapula till the inferior angle. So this artery here is subscapular. This artery here is subscapular artery. But can you see this branch coming from subscapular and winding around the lateral border of the scapula? This is the circumflex scapular artery. That is the circumflex scapular artery, and that's how the anastomosis around the scapula is formed. So I hope this picture clears it up for you. So the anastomosis, a rich anastomosis between the first part of subclavian to the third part of axillary artery. As I said already, that if there is a dislocation of the shoulder joint, this head of the humerus, even if it compresses the second part of axillary artery, we still have other channels through which the collateral circulation can be maintained. Now from here, let's move on further. So we're done with the axillary artery, we're done with the anastomosis around the scapula, guys. Let me take you to this brachial artery and some branches of brachial artery, and then we will see that how it is forming a rich anastomosis around the elbow joint called as an elbow anastomosis.